What's the most embarrassing thing that's happened to you in medicine? I'll go first. When I was a med student, I was observing a spine surgery. And if you don't know what goes on in spine surgery, there are a lot of people in the room. You have usually multiple surgeons, the residents, the scrub techs, the nurses. So it's a busy room. And as the med student, I was scrubbed in, meaning I was sterile, but my job was not to participate in the surgery. I was strictly an observer. Now, a lot of times when you're observing a surgery, you're kind of just standing back in the corner, looking to maybe get a little glimpse of the surgery, but honestly, you cannot see anything. And a general surgeon at the time, he was doing something called an anterior approach to the spine, where he was going through the front, making a large incision, kind of removing all of the organs so that we could get access deep to the spine. He was the one doing the surgery, and then later on, the spine surgeon was going to come on to do this procedure where they work on the disc of the spine. And so he said, "Hey, Erin," he asked one of the nurses in the room to build me like a stool so that I could kind of stand above everyone so that I could actually view the surgery, which was unusually thoughtful of the surgeon to try and really include me in the surgery and make sure that I was having a good educational experience. So the nurse actually stacks a couple of step stools so that now I'm kind of like a foot and a half taller, and I can peer over the front row of people who are actually doing the surgery so I can actually look at the anatomy and see what's going on. So I've got my hands crossed over, my chest. If you're a student, you never want to contaminate anything, so you're always worried you're doing that. So I have my hands crossed over, and I am leaning over to get the best view, just like this. And as I am peering down, this happens. My glasses slip off of my face and fall onto the patient. The nurse gasps. What feels like 100 pairs of eyes are looking at me, looking at the glasses, looking back at me. And in that moment, I want to evaporate. But there was one person who was not freaked out, and that was the surgeon. Now, thank God, the glasses did not fall inside of the patient, but rather on a portion of the patient's torso, which was not involved in the surgery. It was still sterile, but it wasn't inside the wound. And the surgeon asked the scrub tech to remove my glasses from the surgical field, told me to step away from the patient, retrieve my glasses, and then they put something called an IO-band, which is like a big sterile sticker, and just plopped it right on top of the entire field where the glasses had landed. Now, I am almost in tears at this point. I'm actually tearing up right now thinking about it, because I thought that I was going to be in so much trouble and, be kicked out of the room. And instead, after I re-gowned and everything, the surgeon actually made room next to him so that I could actually be next to him and observe directly for the rest of the case. And I will never forget that kindness that he showed to me. Obviously, this was a mistake that I had no control over, just an accident, something that happened. But especially, when you're in med school or in residency and things are really intense and you feel like everything is amplified, so much, every mistake that you make, just to know that I had his backing, that he understood things like that happen and we can correct for those things. I will never forget that moment.